If you are suddenly faced with a frightening, expensive, and potentially life-threatening diagnosis, and you don't feel adequately prepared, here are some basic steps to take. Number 1, start by realizing it's not all about the money. If you or someone you love is sick, of course you will want to obtain the best care possible, not just what your bank account or health insurance can buy. A qualified financial professional with experience in dealing with healthcare issues can help you assess your financial situation against various goals for your retirement, your expenses, your children's education, and other matters. Number 2, grill the patient's insurance agent or HR person. If you or your family members have bought health insurance through an agent or through your employer, insist that they explain exactly what the plan covers and where your deductibles do and do not apply. Generally, a serious illness will quickly require full outlay of the policy's deductible. This is where your emergency fund is very important. Pay attention to how much the insurance will pay and how much you'll pay out of pocket above and beyond the deductible, an amount often referred to as the patient's coinsurance. Number 3, check on experimental treatment and see how it will affect coverage. If the diagnosis is cancer or some other potentially life-threatening illness, in addition to the tried and true treatments, you may want to research medical centers offering clinical trials. And when doing so, keep in mind that some insurance plans might look askance at certain treatments that could potentially lead to other health issues. Use caution in these matters, but if the insurer approves, see if such an experimental treatment can get you a break on costs. Number 4, get those directives in order. A Healthcare Advance Directive provides written instructions for doctors to follow in case you or your family members are incapacitated. The most commonly known healthcare directive is a Do Not Resuscitate Order, a DNR order. A healthcare power of attorney designates a particular individual, a spouse, a friend, an adult child, to carry out your medical wishes if you cannot speak for yourself. Meanwhile, financial powers of attorney designate an individual to handle financial affairs if the sick or deceased can't do it for themselves. Be sure to consult with a qualified attorney, as each state has its own requirements. Number 5, if there isn't a will or a complete estate plan, make one. A will doesn't have to be enormously detailed to relieve problems for survivors, but it can create enormous problems if it doesn't exist. If there is no executed will, the estate is intestate, which means that the property is distributed by state laws. And yet, beyond getting or reviewing a will, it makes even more sense to review all of a patient's assets to determine if more detailed directives or trusts are necessary, and more importantly, to make sure beneficiaries on insurance, retirement accounts, and other investments are up to date. Number 6, consider whether you can make monetary support a gift. It's good to get tax and financial advice on making a one-time gift to support the patient. Would the potential loss of money injure you, and worse, will it injure the relationship? If you don't think you will be repaid, are you willing to consider it a gift? Number 7, ask for generics and samples. Many physicians are willing to recommend a generic substitute or at least supply you with a few samples of the drug they're already prescribing. While doctors can't get away with passing sample drugs to all their patients, always ask. As long as they are prescribing the medication, samples with the proper dosage can provide cost savings to patients. Number 8, begin negotiations before there's a financial problem. The best time to speak with hospital bean counters isn't when you're behind on your payments. Once a diagnosis is made, either you or someone you designate as your agent needs to contact the hospital business office to check on payment schedules and possible discount plans if you're uninsured or fear that your insurance might not cover a significant portion of the costs. Any creditor appreciates a customer who's willing to come to the table first. Dealing with a family health care crisis can be challenging. Stay as calm as you can and focus on dealing with the crisis in a responsible way. Take each of these 8 steps one at a time. Remember, you're not the first person to have ever dealt with a healthcare crisis. You can get through it. Many others have. Do the best you can, and that's all anyone could ask. And join us again soon for another installment of The Financial Briefing.